Thanks, David. Well, experts are sounding the alarm this morning over Australia's booming $4 billion cosmetic injectables industry after authorities seized counterfeit Botox at the border. The fakes are almost identical, same branding and packaging, but the consequences can be deadly. And with the industry forecast to grow 20% every year, there's rising concern that dodgy operators will continue to emerge as demand surges. Now, for more, we're joined by CEO of Cosmetique, Dr. Vivek Eranki. Morning to you, Vivek. Thanks so much for being with us. So what should we look for? You know, if someone wants to go in and get Botox, should they look at the vial? How do they tell whether what they're getting is the real thing?
The two most important things are the people and the place, right? So real Botox can only be ordered by real doctors and delivered to real clinics. So if the Botox is being done in a hotel room, for example, or in a residential premises, for example, then you know that there's something that's wrong there. A well-trained practitioner, doctor or nurse, can actually tell the difference between a fake Botox and a real Botox. And there's a lot of risks associated with undergoing treatments off the beaten path.
OK, so would you say that that is your recommendation rather than asking to see the vial, because the average person probably is not going to know the difference?
That's right. There's many things in the vial that'll help us tell if it's real or fake. For example, most of them are tamper-proof. They have a holographic stamp on them. They have a batch number on them. They have a serial number on them. But these are things that doctors and nurses can pick up on. But just in terms of peace of mind, if a patient was to ask a doctor or nurse, can I have a look at the vial? That is very appropriate. And you should ask that as well. Because chances are that if it is a fake vial, there would be a level of discomfort. If somebody has nothing to hide, they'll be very transparent and happy to show you exactly what they're having done.
OK, so what can happen if you're having something injected into your face that is not what you think it should be?
The problem is we don't know what's in these fake vials, right? So it could be Botox, it could be Botox at a significantly higher dose. And if it's Botox that's not properly stored, if it's overdosed, the problem is that you could have what's called botulism. And what basically happens in these cases is that you can have muscle weakness, you can have trouble breathing. And in fact, this happened in Sydney back in January. We had 3 patients ending up in ICU from fake Botox being administered by a fake nurse inside her house. And these are the things that would not happen if it's done in a proper clinical environment. People often complain about proper clinical environments being cold and clinical. That's a good thing. That's a good thing because you know things are going to be done properly.
All right. Thank you very much, Dr. Vivek Eranki. We really appreciate your insights. Thank you.